Okay, I think we can get going, and we may have a couple of folks join us who haven't been on this call before. And if we need to, when they join, we'll have us all introduced. But since we know each other, let's just go through and any updates that you have that you want this group to know about. And I'll start with you, Chief McKern.
I think I made my announcement. That is that several of us are going to go before the school board. We're going to try to bring Narcan into the Quilcene school. So we're super excited about that. Other than that, the star is Anya and her program. I have heard nothing in the community already this morning that what you folks did last night was amazing, short of amazing. And I know my board was super excited about it. So thank you for doing what you did. Keep it up. And we'll see you all on the 22nd for the drug take back program, where we get to see the smiling sheriff's face. Yes, I'll bring you a bagel, Sheriff, okay? With cream cheese. So.
I'll see, there's the smile.
I prefer a donut.
I know that, but that's a whole nother story. Cream. Yes, sir.
Sheriff, is there a Mrs. Sheriff Knoll?
I'm sorry, what was that?
Is there a Mrs. Sheriff Knoll? My wife is going to come with me to this thing, and she's like, gosh, I'd love to meet the Mrs. Sheriff Knoll.
There is. I don't know if she could, I don't know. We'll see.
I don't know. I'm sure she has a busy schedule herself. So.
Especially on Saturday.
Yeah. Dr. Carlbaum.
Yeah, I don't, I'm trying to think, help me out, team, if there's something I should be saying. Great presentation last night, Anya, and I thought nice panel discussion. Felt like a fair number of people from the local community. And so some good, I think, bridge building and great comments, and some Anya, of course, asked some difficult questions, which prompted some good conversation. So I thought it was great.
Great. I'm going to give it a second for Denise Miller to get her audio connected. And then I might start at Chief McKern and let you introduce yourself just quickly, and we'll continue going around the room. Hi, Denise. Good to have you here. And if you can't speak, that's okay too. I'm going to go ahead to Jim Novelli.
Supposed to introduce myself or tell you what's
and any updates. Yes, please introduce yourself.
So Jim Novelli, CEO at Discovery Behavioral Healthcare, and really don't have any updates at this point in time. So except for a vending machine we're hoping to land eventually. So once we figure out how to free up the money to get it. So that's my update. So
we'll talk a little bit more about that. But yes, Jim's on it. Holly.
Hi, Holly Gum, the coordinator of the Quilcene Brennan Empowered Teens Coalition. Our updates, really, I know we're going to talk a little bit about the Blake decision in a moment, or is this the time for it?
Either or, wherever you're comfortable.
And then echoing Chief McKern's excitement about Saturday's event, the Med Take Back event. We'll be able to take expired or unused meds from the community. We'll also have overdose prevention kits, training in that capacity, and lock bags for a variety of things you want to keep out of young people or other people's hands. So
well, it's going to be a good event. Yeah. Sheriff Knoll.
Good to see everybody. Unfortunately, I didn't make it down to Quilcene last night to see the presentation, but I did watch the show that Anya had sent me a link to, Love in the Time of Fentanyl, and I was mad at you for sending me that because it was a downer. But I can't wait. I hope you're going to be there Saturday because I have questions for you, and thought it'd be a great time to talk about that stuff. So, and nothing new to report here. Unless anyone has any questions.
When we get to Anya, she can give a quick update, a quick summary of how it went down there, so you've got some clue. Denise Banker.
Hi, everybody. Hi, Denise Miller. I am Denise Banker, and I'm the Community Health Division Director here at Jefferson County Public Health, and really want to thank you for being here today, and also thank you for coming to the Blake decision discussion and to the Love in the Time of Fentanyl last night. You're very important community member. And the person I wanted to introduce you to, Holly Gum, is here also, and she is the coordinator of the Empowered Teens Coalition in the Quilcene School District. So I totally want you two to connect. I think you would be fabulous partners. And so that's sort of by way of update. And I'm going to reel back something I said last night at that event, because I thought we had settled that with the Quilcene School District, with Frank and Sean, that we did convince them to put with their AED naloxone. So it sounds like we did not, based on what Tim said just a minute ago. So reeling that back, yeah, so thank you, everybody. I don't have any other pertinent updates. Thanks.
But here's what we love about Denise. She's always got positive, she's like just intending it to happen, and it's going to, because look, they're going to be there next week. It's going to be perfect. No, this week, tomorrow, soon, tomorrow. Anya.
All right. Update from last night from the 11 the time of fentanyl screening. All I've gotten is really positive feedback. So thanks everybody here, Dr. Carlbaum, and for being on the panel, Chief McKern for sending Lieutenant Singleton and folks from your department. We had 26 people attend in person, which is awesome because it's a 30-room limit, so 30-person room limit. And then we also had 8 people online. And then it sounds like there are a few people like Sheriff Knoll who watched a link that I sent them. I'm going to drop a link in the chat in a little bit. So if people haven't seen it or people want to share it, there's like a moderator link, and I'm happy to share it more widely now that my events are done. So yeah, I was really happy with how that event went. Curious if there's more opportunities to show that film, maybe at the Brennan Community Center as we're building out the plan for the vending machine down there, maybe at the Hadlock Library, just thinking of more communities outside of Port Townsend that would be appropriate. I'm going to the Quilcene School Board meeting tomorrow, so hopeful about getting naloxone into the Quilcene High School. We have, I'm also screening Love in the Time of Fentanyl on Friday at Recovery Cafe with Brian Richardson. So excited for that. And then Saturday is Med Take Back with Holly, and definitely looking forward to some thoughtful conversation with you, Sheriff, so you can bring all your hard questions for me. Another thing
You just can't hold it against me.
No, of course not. We're all learning, and
I know.
And the harm reduction ethic, I'm meeting people where they're at. So whatever you have for me, I'm happy to discuss. On my team here at Public Health, we've been talking about expanding the syringe service program down to Quilcene. We have that clinic space there by the post office. So we're talking internally about what we need to do to potentially send me there once a week and support expanding those services down there. I'm also excited about the vending machine conversation and about the emergency naloxone boxes. I've been looking at different funding, talking with Denise to see if there's any internal funding that we have at Public Health, also looking at the OCH grant and different opportunities because we're seeing lots of vending machines pop up across communities throughout the United States, and it feels like our community is ready for that. So want to continue those conversations. If folks have ideas for more opportune locations for those or want to collaborate on that, please reach out. That's all I have.
Thanks, Anya. Any questions for Anya?
Yeah, I was just curious. It sounded like everything went really well last night. Were there people that were appalled by such an idea or anything like that?
No, only words of support and like kindness and compassion and understanding for folks who are using drugs and for folks who might be in a chaotic place. So lots of like consensus on, the long-term approaches of like pushing people into isolation and shame and stigma around banned substance use isn't working, and what are ways that we can create more community and connection. And if not this model in our community, what are like other models that would work for our community to help connect people to services and prevent overdose.
That's really encouraging. Yeah. Thanks.
Thank
Even
you.
in some of the after conversations, you know, people were recognizing, okay, so what we saw there is a very urban model. But what makes sense for this community? And I think that that's it. The community there will drive whatever it is that we come up with. We just want to enable it, whatever that is. And then I wanted to also say about the vending machine possibilities and the wall mounted vending. We do have some money in the grant that we're, you know, as we're working to get all of it out, we might be able to purchase some of the wall mounted ones using grant funding, but doing a PO through public health. So that's something to explore. Denise Miller. Oh, wait, hold that thought, Denise. Dr. Carlbaum, did you have a question on that?
I just want to give Chief McKern an update that Lieutenant Singleton was quite wise and observant that EMS was being activated a lot in Vancouver, and said, you know, if we're going to have a safe injection site, I worry about the impact on EMS. And so I think that's one of the components, if that were to show up in its modified form, that we'll need to think hard about. I don't think it has to impact EMS that much. I think that movie was done at a time when people were probably less comfortable with leaving people after naloxone. But he was very thoughtful about that.
Thank
It could also be because he's had 3 walk-ins Narcans here in the station. So he's definitely an impact. They check, I think they look on the calendar to see that C shift's on and know that Nick's working, so they'll just come here to the parking lot. So
Okay, Denise Miller.
Hi, Anya. Thank you so much. I'm Denise Miller. I'm a local in Quilcene. I attended the film last night, and I'm involved in the community. I work at the school district, and I'm actually hoping that I can connect some different groups to network about this and maybe partner. My church is the Quilcene Assembly of God, and we just created a youth ministry to help with prevention in Quilcene. Specifically, we have a group of children and teenagers that come on Friday nights, some with their parents, and we play games, and we're working on more of a prevention platform. So it would be nice if I could talk to our church and we could partner with some of you and the school and possibly the community center. I definitely think this is a shared job. It's a big job, and it's going to take a lot of different entities working together to try to sort of catch this before it becomes a problem, you know, like Vancouver. But the film was incredible, and I really appreciate having access to that film. It was amazing. It's a conversation that I think some members of our community are not quite understanding what this is about. So maybe educating the Quilcene community more about naloxone and helping to answer questions would help. Maybe our church would be a point of contact. I gave some information about how to contact them. And certainly my background is that I worked at Harborview Medical Center for 6 years, inpatient psychiatry, and had a diagnosis unit where I worked on the floor. Post overdose, post suicide attempt, people with addiction and mental health issues. And then I worked in youth through the tribes and United Indians of all tribes. I worked at a homeless youth shelter called La Batea. And then I now work at the school district, and I have a background in healthcare as well, other hospitals I've worked at. So bringing that to the table, I would love to be more involved here and maybe be sort of an ally at the school board meeting. I'm a very active member. I have only missed 2 board meetings in the last 3 years. So they know me at the school board. I'd be willing to help advocate for the naloxone there and also continue to support you in our community of Quilcene as a parent of a senior.
You bring so many different points of contact. I'm going to sort of open it up to folks as they've heard who you are. Does this spark any conversation or connections you want to make with Denise? I'm Denise, I'm so appreciative that you came on such short notice. I really do appreciate that.
Denise, I feel like I'd be a great prevention partner, and I'd love to get your email and we can talk. I think we met during the Blake decision meeting as well. I remember, I can hear your voice now, and now your face is appearing in my mind. So let's follow up for sure.
Great, and I can pass on that. I can pass an email to the both of you so that you guys are in touch. Moving on to Lori Tinker.
Hi. Well, I really appreciated the opportunity to be there last night. I think I just contributed warm energy and not much more in the room. But I certainly, I think that from where I'm coming from is to be a voice that this is to have a very large perspective. I think I told Lori last night, right before I came, I had to cut my telephone call with my sister off, who lives in Ohio. And I said, oh, I have to leave. I have to go to a movie. And she said, oh, what are you going to go see? And I said, well, it's not that kind of movie. And I said it was a movie about fentanyl and fentanyl overdoses and just the looming crisis. And she said, I'm so glad I live in the Midwest because that's just seems to be a coastal problem. And this is by no means the first time my sister has really missed the mark on a lot of things, but just bless her heart as I do. But I think that the realization this isn't just a big city, inner city problem, a rural community problem. This isn't an inpatient psychiatric bed problem. This isn't just a pre-hospital first responder problem. This problem is big enough to saturate virtually every area, and is at an incredibly alarming pace. In literally 50 years of working in hospitals, a great deal of it in emergency rooms, I've never seen even PCP of decades ago, I've never seen an explosion of drug use, of one specific drug use as quickly that has infiltrated so many things. So and I just think getting you all who are the voices and the experts of your neighborhoods and communities in rural areas, because I see that as such a specific provide treatment area, a specific area that's going to require some very special approaches, and what works in East Van is not particularly going to work in Brennan and Quilcene, and but something will work, and we just need to keep getting the best minds of the community together and figuring out what is going to help. So I really enjoyed the being there, seeing the response, seeing the diversity of people there, and I'm certainly willing to continue to be as supportive as can be in my position on the EMS Council.
Thank you. I'm really glad you were able to be down there last night, Lori.
Even though I always forget how long it takes to drive to Quilcene.
At least it wasn't snow. That was good.
Yeah, that's true.
That was really good. Holly, did you want to give us a quick update on sort of what's happening with the Blake decision or the Blake conversation?
Well, I can talk. Did you want to talk about the March 27th event, or just the present, the status of things as it's morphed and evolved through each chamber?
You are welcome to give like a quick sketch of what that event was, and then sort of where are we at with the actual decision. Yeah.
Sure. If you give me, I can actually pull some pieces up. Is there another section you wanted to move on to and give me 2 seconds to
Sure,
pull
sure.
everything together? Because I
While
would hate to
she
be given this information.
while she is doing that, let's talk a little bit about the vending machine. So let me tell you this, the scoop. HRSA has said yes. Now we need to figure out how to get the money out of the grant and into DBH's hands so that they can make the purchase. Because there is the potential that the feds could, at the end of the grant, consider asking us to relinquish it because it would be equipment bought with federal funds. I'm imagining that with this thing, a car, maybe it's more of a question, but with this thing, I can't imagine they would want it back, but they are very clear in saying that they're not going to make that decision until the end of the grant. So that then begs the question of, is there something special that needs to be written into the contract about the funding that we would use to buy it? And Phil Hunsucker, who's the county lawyer, is on vacation right now. So we're in the midst of a limbo land trying to figure that out. I will say I'm very grateful to have Ann Dean over at DBH, who is doing some superhuman interconnection for us to try to get somebody in the legal department over there at the county to give us an answer so that we can get that moved forward. One of the things that we could do is, if we are really concerned about that relinquishment factor or clause, we could ask for a no-cost extension on the grant, or as long as they would give it to us. So at least that would put out when that decision is made by. But these are all things that are kind of up in the air right now. In the meantime, we do know that we want to move with intention to get some wall-mounted boxes up and around. And as you heard, Anya's got some things that we're tracking down, and whatever the fastest way is to move those out into the community. And it might be to go through a PO process at Public Health, have it billed to the grant because the money is already there at Public Health instead of having to go through a large contracting process. So we'll see, but it's very much on our minds of how we can get that done. What I thought might be useful is to ask, is there any place that folks would like to see us put one of those up, in addition to at the Quilcene fire in that alcove there, Chief McCurran, that you were telling us about? I know we talked about the possibility of putting one at the Brennan fire station somewhere. Is there other places that you can think?
Is this in lieu of the vending machine, the bigger vending machine?
I think it's in addition to. So
In addition to, okay.
is sitting at the Brennan Community Center, which is a great location. Lots of people, especially in the summer tourist months, are zipping up and down that road. So it's a perfect location, but these would be in addition to. And Dr. Carl, I see your hand.
Yeah, I've not ever been to the Quilcene Community Center until last night, and didn't realize how proximate it was to the road. And it sort of seems like maybe one of the first buildings you encounter when you come into Quilcene from the south. And I wonder if that would be a good location. I know certainly some people have driven that way past the community center to the fire station with someone in need of Narcan. And I wonder if that could be a good fit. Also, the food bank is there, and so it seems like a place where there's lots of folks.
Mm-hmm. Chief McCurran, any thoughts on any of those? Did we catch you as you were distracted?
No, I'm thinking out loud.
Okay.
From security standpoint, and I'll have to lean on the sheriff a little bit, probably not the greatest of areas to put it. We're a little more secure here in the station. We're around the corner, and it's a little bit off the main drag. That particular building happens to be a focal point, and it seems to attract not the right crowd. And so I think we need just a little bit more security than that. Would be like saying, let's just put it in the post office, where the post office is open 24/7. Probably not it's a good place. Yes, I agree. But it's more, we finally got the AED up and running. They've got an AED there for the folks that are using it, but it's only open for a short period of time. The windows are like from 2 to 4 or 2 to 6. It's only open for a small period of time. And other than that, there's some transient folks that hang around in their little campground right next door. So don't know if that's the right answer. I could be persuaded either way.
I personally think that it's a good idea, and especially I understand where you're coming from, Chief McCurran, and maybe with some of the more expensive equipment like the machine that we're looking at for Brennan, potentially that wouldn't be the right spot. But the the little emergency boxes, they cost around $400. And, you know, if people are taking the Narcan out of them, then like, that's what they're for. And if people are hanging out there and if maybe not the right crowd correlates to people that also might be connected to folks who are using opiates, then like, that's who I want to see it and who I want to take it. So I think the community center is a good spot because the food bank is there. I want folks to feel comfortable and confident to call EMT or go to the fire station. But I also know that sometimes folks who use drugs might have negative associations with those kinds of services and might feel more comfortable going to someplace like the community center where it is less monitored. So I think that one of the emergency boxes there could be a great spot to try it out. You know, if it's not working or it's getting trashed or something, we can uninstall it and install it somewhere else. But I like Dr. Carlbaum's line of thought. I did a training for OLLICAP a couple weeks ago, and I know that they're interested in putting up some boxes at their locations. I don't know if they have places in South County specifically, but thinking of places around like Hadlock, Chimicum, maybe Bayside Housing, maybe their new motel project out there, the library down there, things like that. The food bank down there as well. Yeah.
Sheriff Knoll? Thank you, Anya.
What are those boxes? How do those boxes work? I mean, how does someone get into it?
I'll drop a link in the chat in a second, but it looks like an emergency like metal box and there's a key in it. We have one outside of the Suquamish Wellness Center. And no one's messed with it. People have accessed it, but it's just like kind of like a little, newspaper box or something that anybody can unlock and you can take out a naloxone, and it has an instructions on how to use it.
Okay. Yeah.
So we don't have to break the glass in order to get in.
Yeah, and I get where Chief McKern's coming from, but I have to agree with Anya that I know myself, if I was anyway, I wouldn't want to go around where, I mean, firefighters or cops or, do they have cameras? Do they, I don't know, that I could see maybe it would get more use if it was in a place that wasn't associated with a government type entity.
If I'm feeling compromised, I don't want to go see Chief McKern. Is that what you're saying?
Well, and I'd have to say too, that one thing good down there is that the fire department is right around the corner if there was something going on, like an emergency. So that there's that as well. I think that it's close to the Quilcene Hospital, if you want to say.
Mm-hmm. Thank you, Sheriff Knoll. Denise, did you have a thought? Denise Miller?
I was just going to say on this matter, I'm still learning about everything that you're working on. I would suggest anything you do with Quilcene that maybe you put some kind of little public survey out, like a Survey Monkey. If you had a chance, that's very helpful in engaging the community members who are interested. There are people using fentanyl in the community of Quilcene. They're very secret. Some of us know who they are. And those people do need access to the naloxone, and their family members do. Some of the students at the school have parents that are using. It's just, it's a big don't ask, don't tell community. So trying to flush out getting the help to the people by making it okay to ask for help or to access the naloxone is very important. It's just a hard nut to crack in Quilcene. So I'm just suggesting anything that you maybe try to do some kind of a community survey or try to put this film out again for people to watch. Maybe like a night where the parents can come and see it. I don't think people really identify the school students with fentanyl, but because they have siblings that are engaged in the drug community, I do think everyone in Quilcene is at risk to have some sort of contact with an overdosing person. And I think it's really important because of our isolated location to have a way to help someone.
Mm-hmm. Jim, I'm going to go to you, but I just had a thought, so I'm just going to put it out there and you can all smack me. Do we carry naloxone on school buses? Or could we? Should we? Okay, leaving that there. Jim.
I don't know how much they cost, but I don't know how much money is left in the budget. But wouldn't it be wise maybe to buy 6 or 7 of them and then figure out where to distribute them eventually, and that we have them on stock and see where they work, instead of doing one at a time and then the grant runs out and we have no money left? I don't, just
Mhm.
trying to think ahead. So,
Yeah, no, it's a good thought.
yeah.
I like that idea. Let's buy 12.
Can we store them at your house, Jim?
Sure. And nobody can get near them because my dogs will rip them apart. Except for Chief McKern, he looks peaceful enough. They'll let him by. So,
And thank you, Denise Miller noted that there's no meds on the bus per federal guidelines, so good to know. Okay, any more on that topic? Are we, okay, so Chief McCurry, you've heard a big discussion here.
I guess I just had one. I was
Okay.
looking at the link that Anya sent out, and they're the newspaper-like things. Is that what you said? Newspaper.
There's multiple versions. There's the newspaper-like one, and then there's also like the metal cabinet. I just shared a link with all of the different versions. So different versions, we could buy different versions and try them out. The one that we have at Suquamish is the metal cabinet.
Oh, okay.
And now I'm circling back to Chief McKern. Is there anything more you'd like us to track down? I hear your carefulness. Okay. All right.
I could be convinced, and I'm not going to go against Anya. If Anya said it's going to go there, it's going to go there. That's the way it is. So she's in charge.
Yeah, quick question for Chief McKern. During the summertime, do you have many responses up to camping sites up to Duwamish? Anything? I mean, any? Is that an area that?
Always.
Yeah,
Population
seasonally-
quadruples. Oh yeah. Yeah.
Mhm. Gosh, it doesn't sound like that's something the federal government would allow us to do, but it'd be really nice if we got some naloxone distribution up there, up there. Maybe we could do it and say we didn't or something. That seems to
Chief,
work with the federal government.
Are there campground hosts at some of these campgrounds? People
Well,
that live
campground
there?
hosts, they would have to go to, basically, you're going to take them up to what we call, it's a parking area where they camp, where they hike up in. Probably the one of anything at camp wise would probably put it at Mount Walker. Because that seems to be that's the hot button for everybody, usually ends up at Mount Walker before they go up. So.
Mhm. And a QR code for a video that shows how to use it. Yeah.
Yep.
Other thoughts on that? Quickly. Well, first, are there any other insights? I know we've had both the Blake decision panel that went on, we had the discussion that happened last night. Other than what we've already talked about, are there any actions that we want to take as a result of the conversation last night or the conversation at the Blake panel? Any things that we should be thinking about as we go forward and do future events, perhaps watching Love in the Time of Fentanyl? I'm just looking for feedback before I.
On Jim's note, I mean, I think we should go. I mean, I know that purchasing and getting things going can be time consuming. So I think if we're all in agreement, like deciding on a number of boxes and to start that purchasing and then figuring out where they're going to go. So I would be in favor of starting to purchase them.
All right. Do we have general agreement here? If we purchased 5, 10?
Yeah, I mean, I'm looking at them here. The simplest one that holds several, 2 3-bay ones are $349, and that's super expensive. So we'd have to look. There's different variations. Actually, ones that hold all sorts of safety equipment, put an AED in there and Narcan. So kind of interesting. So they're not talking a lot of money.
Are we talking just South County or for the whole county?
I think we should draw up a list. Here's what I would like
Yeah.
to do. And I know this is South County harm reduction. I think we should draw up a list of all the places that we think it'd be great to have them. And then maybe, the next list of things we're not all agreed, but it could be a good place to put them. And then prioritize throughout the county. South County, this is what we're talking about here, but I think throughout the county when we're thinking about this grant and spending down the funds.
I volunteer to help collect that list. If people want to send me ideas of locations to my email, I'll make a Google document and track it, and then I can share it with the whole group and we can input ideas in there and then figure out how to prioritize them. Does that sound good, Lori?
That sounds great. And if you think you might forget, pop it in the chat because I'll save the chat and send whatever gets in there to Anya so that she can add that to the list. All right. I'd like to quickly look at the app. Go ahead, Dr. Caldwell.
Denise has a great comment in the chat about any tribal participation, which I think is very thoughtful and wise, especially given the King County overdose data that American Indians and Alaska Natives are 6 times dying from fentanyl 6 times more often than white people. And then my only other thought from last night was the super cool person who's working with kids. Was it Ave? Like, do we need more sort of that representation? Like, we have like a lot of adults and older adults here. I'll let you self-define that. But do we need, you know, a 21-year-old or a 22-year-old who has that different perspective?
I would love to see Ave on here. I loved her last night. Well, let's just get the kids trained. What's up with that? A couple of things that I'm thinking. One is public health might be the route to connect with Anya, with Ave, to see if they are interested in being in this room or at this table. And then the other thing I was thinking is Denise Miller might be able to connect us with some local kids who are interested in sort of being a part of this whole effort. Yes, thank you, Denise. She's noting in the chat. And then one of the things that I remember hearing from somebody, and I'm trying to remember who, is that after the thing last night, you know, we had done some training, but perhaps somebody who doesn't quite remember or is worried that they won't remember when they need to, how to do that specific process around the naloxone administration. Is it possible, Chief McKern, if somebody came to the fire, you know, to the department there, that they could connect with somebody who could give them a training if they asked? Is that something that we could say aloud, or shouldn't I be saying that aloud?
24/7, 365, 24/7,
Okay.
365. There'll be
All right.
somebody here.
Okay, so I think that might be a nice way. I mean, so we'll have a QR code and we'll have you could do it in person.
However, at midnight, 1 o'clock, I can't promise you they're going to be really awake, but you might try during the day would be a better off.
If they come at that time, they need to come with coffee or a chocolate bar. Or,
Absolutely.
yeah. Okay. Other thoughts on that? Before the last thing I want to do before I let you go is to look at the acronym sheet that I put at the end of all of my presentations that nobody looks at. And I want to stop for a second and ask Denise. Denise, I'm sorry, I didn't see your hand earlier.
Did we forget Holly's update?
We did. Holly. Holly, I'm so sorry. And we want to know what's going on. Clear the decks. Holly is up.
Sorry about that.
No worries. That's on me.
Thank you, Denise. There's not a whole lot really there. I feel like the 27th went wonderfully. There was a lot of really good discussion. I feel as a whole, it was a great, respectful place to just truly, you know, come and learn with an open mind. It's okay to, you know, ask questions without the fear of, you know, that's a dumb question or we don't do that anymore. There was a lot of just mutual respect and true inquiry. For anyone that's not familiar with what the 2021 Blake decision was, it was a case that made it up to the Supreme Court that essentially said, if someone is unaware that there are substances on their person when they're engaging with law enforcement, that a charge cannot be applied there. So when that ruling came, there was not a whole lot of good instructions on what to do from there. So folks, maybe, you know, law enforcement's feeling like, hey, you know, we were in a place before to, you know, intervene in some capacity. Now that's not happening. There's folks that are, you know, again, in situations that, you know, they're going to harm themselves or someone else. So there wasn't a whole lot of good infrastructure to support that. And so this legislative session, there was a couple, it started out with a bunch of different, you know, fixes or thoughts on how to approach it. The one that's kind of made it here to the end is Senate Bill 5536, I believe. Let me pull. This is what I have to pull up because I can't remember all of the numbers that are happening. 5536, yes. And so it made it all the way through its House of Origin, which is, the Senate, and then it had various iterations there, went over to the House where, again, it was amended further, and then another committee is like, well, we don't like that. We're going to go back to a couple amendments ago. So essentially, from what I understand, it's some of the big takeaways are essentially folks will be presented with the opportunity if they are arrested by law enforcement and they have a controlled substance that they're not supposed to have on them. They have two options. They can engage in a treatment or diversion program, or they can skip it and elect to do a time in jail there, up to, I think, 365, up to a year, depending on, a bunch of circumstances there. If individuals want to finish a program, then at the end of that successful completion, they can have that charge vacated. They don't have to, have that follow them anymore. And it's a huge bill because built in is all of it's not great from a public health standpoint. There's still a lot to be worked on in terms of defining, how are we going to make these treatment programs available? So if you want to read through the bill and its amendments, and I'm missing so much of it just because I'm trying to kind of rush through it. I'm going to put the bill in its entirety, just dropping it in the chat if you wanted to kind of search through. But it does earmark quite a bit of money over the next several years to really staff, build, and support treatment facilities, whether they're a freestanding permanent location or a mobile unit, similar to what we see with Believe in Recovery there in South County. So optimistic that things are moving. Right now, it has gone through both houses. It's in a phase called concurrence, which means it was so changed from what the original in the House, from what the Senate had said. They have to go back and go, are you still cool with this, essentially, before it goes to the governor's desk. So hopeful that, yes.
Hi, Sheriff Mill.
Oh,
Thank you, Holly.
I've been following it too, and my understanding is that the last action they took was on April 11th. And basically, to me, it came down to the Senate wants it to be a gross misdemeanor for possession, and the House wants it to be a misdemeanor. So it went through the Senate, went to the House, and the House said, no, we don't like that. So nothing is final yet, is my understanding.
Correct.
So we're still waiting. And I forget when the last day of the legislature, like the 24th, or I don't know if that's right.
It's coming up.
Yeah, so it's, like Holly was saying, it's kind of getting tossed around between the Senate and the House to kind of come to a compromise, I guess. But by the same token, I've been told that it could also be that it just doesn't get voted on. So that's a possibility as well.
That is absolutely true. Things can, it's not over till it's over kind of a thing. So super important to keep tabs on those, and truly encouraging, folks that are like, I don't know what to do about this. It feels so out of my hands. Writing letters to your legislator throughout the year, telling them what is important to you is such a huge piece. So we should even be thinking from a harm reduction strategy. We should be sending notes to Theringer and Chapman and Vandaway throughout the summer and the fall, and continue to let them know that, listen, we need this. We need you to be our champions, and talk to other committee members of the places they represent.
I don't want to hijack the conversation, but I guess I kind of will. My understanding too is that, so they're I mean, I love our legislators, but they're coming up with these ideas, and Jim could probably attest to some of this, with all these good ideas on how to do these things, but it's going to cost money. And, where's the money going to come from to make all this stuff happen. So.
Mhm.
And it's more than money. It's got to find staff to actually
Well,
staff.
yeah, and then you got that on top of it, so.
Yeah.
The budget is a
In a way,
huge,
I thought that the Blake decision, it's like opened up this idea of how can we do things better.
Mhm.
But it's gonna cost some money. I mean, I've even heard ideas of having like places where you can take people instead of jail, you know what I mean? I'm drawing a blank on the names right now, you know, like somewhere you can go dump somebody off so they don't have to go to jail and they're having some kind of medical emergency, you know, that some of that, but could be mandated. But there's, you know, there needs to be money and facilities and, like Jim said, people hired. So where it's all going to end, who knows? But like Holly said too, you know, that's why it's important to keep our legislators advised throughout the year on what we're standing for and what we want.
and they are not subject matter experts in everything. They really do rely on input from communities and subject matter experts in their respective fields, because truly they are building laws without having, you know, some of the deeper fundamental understanding. Listening to some of those debates back and forth, I was really sad to hear some of the commentary back and forth, because it's truly, you know, really wanting to go back to these 80s, you know, thoughts of, well, they need to see more pictures of an egg in a frying pan to know what their brain is looking like, when that's not an evidence-based solution. That is not a helpful, useful strategy. But yes, definitely the community plays such a larger role than one would think.
Thank you both, Sheriff Knoll and Holly and Denise. Between all of us at this table, we have a better, well-rounded understanding, hopefully, as we walk out of the room of this meeting. One of the things that I would like to talk about at a future meeting is one of the things I realized is that law enforcement was dealing with all of the compassion fatigue that one might feel in the spinnaker, and not just law enforcement, EMS as well. And that compassion fatigue, as we switch up how we're doing things, whether it's the Blake decision or something else, is going to get spread across a wider range of people. I think the more people, if we take it just right out of the, you know, hospital, EMS, sheriff, law enforcement circle, and we spread it around to whether it's that we have places where we're putting people and communities there have to deal with them. I think that that's a real topic of conversation that is worth being real about, where it is right now, why it's there, and what we might possibly do about it going forward. Because I think it's real and it's understandable. And something to think about.
Can only be compassionate for so long, and then we get mad. So,
And we get saturated. That sponge is.
I'm being funny, but yeah, it wears on all of us, you know.
Yeah.
Watching that movie yesterday weared on me. The Love in the Time of Fentanyl.
Yeah.
But, you know, and we all deal with that stuff. I mean, we know that that's real. That really happens in the world, where I would say a vast majority of the public doesn't know that. Anyway,
You know, one of the things that I was thinking last night when Amelia was speaking and one of the things that we try so hard in emergency rooms and emergency departments, and I'm sure you do too with your EMTs and all, is the term that we use so frequently, oh, he's a frequent flyer, you know, oh, he's known to us. You know, this is a frequent flyer. It's just that wearing down of, we know him, we know, you know, this is what's happening, you know, but that chips away with the humanity, because it becomes a frequent flyer instead of a human person. And I think that, and it is accentuated in communities where our numbers and our responders in our hospitals are smaller, because it's much more intensive. You do see people repetitively, and it is so hard to take that deep breath and approach them with a clean slate.
Mhm. Yeah, all right, conversation for a future meeting. Quickly, I'm gonna take us to the acronym sheet, just because as I realize, as we have folks join us, it might be really important to have this up to date. Can you guys see a screen that says acronym sheet? Somebody give me a thumbs up. Yep, good, okay. Could you have a look at this and see if there is anything else that you can think of? And Denise, I don't know, Denise Miller, I don't know if you're aware you can see a screen, but particularly for you, I think it would be handy if you've heard something that you wished you knew what that acronym stood for, if you let us know so that we can make sure to add it to our general list. If you see something I have wrong on there, you should tell me that too.
I don't know if it's important, but maybe you could add JCSO for the sheriff's office. I don't know if that
Yes,
shows up.
HIJ. Oh, look, there's a perfect spot for it too. My columns were uneven.
And I suppose that,
Missing-
that
we're missing-
would actually, well, you have PTPD on there, yeah.
Yeah, I don't know. Why use that?
Is it supposed
have-
to be in alphabetical order? No.
What are you saying, Holly?
Is it
The
supposed?
QFR.
So Lori, I mean, I'm a little disappointed that DBH isn't on here at all.
All right, JS comes after JH, please hold. Let's get that, and then DBH, and then
Because you put, other people on there. I don't know how many acronyms you want.
the ones that people wouldn't know. That's a good one. Is it apostrophe S, Sheriff? Jefferson County Sheriff's
Yes,
Office.
because it's mine.
It's yours. DBH,
That's a joke.
others, anybody else?
The Syringe Service Program, SSP.
You?
I also wanted to let folks know that I dropped a link in the chat to a Google spreadsheet that I started to populate with potential ideas of locations for the boxes. And just off of the top of my head, I wrote down 17 ideas. So I think that 10 is a great number to shoot for. But some of them, might not be welcomed, but I'm just thinking of all the places and starting big.
Okay. We've got 7 minutes. If you gotta leave, you could, but if you wanted to look at this list that she's just put in and do any responding now, we could.
I have a question. I don't know. I'm just gonna ask it. When things get put in the chat like that, like Anya's link, what I did was I highlighted it and copied it and then pasted it into a Word document. Is there a better way to do that? Like when the meeting goes over, all the links are gone.
Oh, so I can post this chat. I will get a chat document at the end of this meeting because I record it, and I could post the chat document along with the video up on the harm reduction website, which how many of you even know where that is?
We all do.
Of course you do. And just, for the sake of having it close, I'm putting it in there,
There it is.
where you will go to find the chat.
Okay.
Okay.
I just wondered if I was missing out on somewhere. Oh, you just have to click on it and it automatically goes to your email.
That would be cool. But I don't think so. Okay. Are we looking quickly at that document, the Google Doc? Okay, opening it up. Anya, thank you for doing that. So,
Yeah, Anya's got a couple of mine, sort of we've got to get something in downtown Bremerton. And I mean, boy, what a place. So the library, the Water Street bathrooms, yeah.
Oh, and Port Townsend, yeah.
any other ones that you'd like to see us add to this? Do you want to take a run at prioritizing them? Come on, with just us here, we could have a huge say.
Well, I feel like the Quilcene Fire Station, I feel like is the first place because we already have buy-in. And that seems like, I mean, you can say yes or no, of course, Chief McKern, but to start with like a public respected place like that and then be like, oh, well, we have them at the fire station and seems like a good kind of communications messaging and community buy-in.
I'm not going to say no after being in the last year having 4 pull up here, then I'm definitely going to say yeah, that's probably a good plan. And I'm leaning toward the Quilcene Community Center. I think that's your number 2 spot, especially
Okay.
because it's got the food bank there. Anya and the rest of you convinced me, and you know, I think that's probably a 2 for me.
Okay, great. I'm putting the fire station just so that we treat all fire stations equally.
What about the, like the Coswell Brown encampment? I just don't know if is that singling people out? Is it,
No, I'm open to that as well. Like I go down there on Fridays and I bring them naloxone and I do like rounds there and check in with people. But there isn't an emergency box. And I think OLLICAP, people in their meetings when I did their training last week mentioned multiple locations. So I think they would be open to that.
I guess another one, just thinking out loud, you know, what about like the Haynes Street cabins? Is that where they are, the cabins over? I don't, you know, I'm just throwing that out there. I think especially the Coswell Brown, it seems like they're kind of isolated out there.
Yeah.
Right.
And they're clearing the DSHS woods.
Well, and then
city-
that place, yeah,
more
that new
people.
one there. Yeah.
Yeah.
So my question is, quick question, does anyone know how these are mounted and what it takes to mount them so they're kind of secure? I mean, they just can't dangle on something. I mean, you're talking about,
Christmas tree decorations.
yeah. You know, just, you know, we're talking great places, but do we have the ability to mount them on something that, you know, I'm sure it takes some screws in the back and you mount them and hold them on something so people can get access?
Yeah, I can't volunteer people, but I'm wondering if these are things that public health buys with the grant money, if I might be able to talk to my team about public health facilities supporting some of the installation.
Because I don't know if Chief McKern was planning on installing it, if we got it for him and he was going to mount it on his wall.
So we need a couple.
It's definitely going to be pretty easy because I'm talking about metal siding, so it's pretty easy to put some metal screws in there and
Okay,
attach
yeah.
it to the wall.
Right. So
Lori
Am I going to
Tinker?
attach it? No, I'm not going to. Somebody will.
I thought you were going to show us how to do it. So
Do we, I missed the first part of the discussion. Is there a plan yet how these are going to be serviced and refilled? Because nothing can be worse than to have it up there, have somebody go to it, open it and have it empty. And so it's, you know, 10 boxes spread all over the place is a circuit.
Mhm.
It's a daily circuit of supplies, basically. Have we
Yeah,
thought
this
of that, approach that?
Something that I've talked a little bit about with my team at Public Health, and that I feel like I could be a point person and maybe building relationships within those communities. So I'm finding, you know, someone like Denise or someone who lives in Quilcene and say like, you're the captain of this box. Can you check it once a week and check in with me? And that captain I could make sure that they always have 5 boxes of naloxone. So when it dwindles down, they could load it up. And I can get a naloxone supply from DOH, from the PDO naloxone that I'm doing for distribution. So the medicine itself can be free, and I would like to help coordinate that and keep a system of, you know, building leaders within that community to like have ownership over those boxes, and supporting those people to make sure that they're always stocked. And I can write up like policy and plan for that as we, you know, move toward making it happen.
Mhm. Sounds good.
On the Quilcene side of things, we'll take care in the beginning, unless someone has a desire, the fire department will take care of our own, you know, our box and the community center box. We can take care of those. I don't want to take on, if there's a few more in Quilcene, we could take that on. But as far as if there's somebody else that jumps into it and says, hey, I want to get involved, if it's a church
Mhm.
group, whatever, we'll certainly, again, it's all about partnerships. And so if we can partner with somebody, that's awesome. We have a place to store them and lock them up to where they are somewhat secure. I just don't want them sitting out on the cabinet. So
That makes sense. You guys, thank you so much for an hour of your time today. We filled the whole thing. I really appreciate you guys. You are now released. Is there any last minute, anything that somebody wants to say before I close out the room?
Peace.
Peace, peace. All right. Thank you, you guys. You're awesome.
Bye. Thank you, Lori.
Bye. Thank you, Denise.